This page is just kind of an intro to ALS with some general fun facts and trivia. ALS occurs when motor neurons in the brainstem and spinal cord begin to degenerate and die for unknown reasons. These motor neurons are responsible for voluntary muscle actions such as walking, talking, eating, and breathing. So as more of these motor neurons die, these voluntary actions become more and more difficult. Muscle wasting also occurs due to denervation and general lack of use. However, it is important to note that only motor neurons are affected in this disease, so one's intelligence generally is not affected. So ALS can present with a multitude of symptoms. Unilateral weakness and fatigue in extremities is very common. Difficulty with fine motor skills, such as writing, holding cups, utensils, things like that. Your vocal pitch can change. You can also have slurred speech. Trouble swallowing is commonly reported. Muscle cramps and twitching. Uncontrollable periods of laughter or crying can also occur. But your senses such as sight, touch, hearing, taste, and smell are not affected because those are not controlled by motor neurons. So this chart does a good job of going through all of these stages and explaining the clinical features that are defined by that stage, as well as recommendations to help maintain motor function and their lifestyle at that point in time. So in stage 1 and 2, you would still be ambulatory. Stage 2, obviously, you would have a little bit more fatigue and weakness than in stage 1. Then when you get into stage 4 and 5, you start needing a wheelchair or a power wheelchair. Then once you get all the way down into stage 6, you really become completely dependent on your caretakers. You're not able to really perform anything for yourself. And that is the final end stage of the disease.
ALS diagnostics. ALS is a difficult disease to diagnose since there isn't just one test to make the diagnosis. Patients will undergo a series of tests and labs to rule out other diseases that have similar signs and symptoms. A physician will look at everything together as a whole: the patient's medical history, their signs and symptoms, their labs and tests, to diagnose a patient with ALS. However, a strong indicator of the disease is upper and lower motor neuron symptoms. Diagnostics and labs, which include nerve conduction velocity, which finds issues with the nerves; electromyography, which is done to detect problems with the muscles, and these two procedures are normally performed together. Blood and urine studies, including high-resolution serum protein electrophoresis, thyroid and parathyroid hormone levels, and a 24-hour urine collection for heavy metals. Spinal tap, which is done to analyze cerebral spinal fluid. X-rays and MRIs are done to get images of the brainstem and the spinal cord to rule out tumors and other diseases. Typically, ALS patients have normal MRIs. Myelogram of the cervical spine. In this procedure, the contrast medium is injected around the spinal cord and in the nerve roots. The contrast allows for X-ray imaging of the spinal cord and the nerves to be seen in real time to look for anything abnormal. And then you have muscle and nerve biopsies and a thorough neurological examination. Now let's talk more about how nerve conduction velocity and electromyography work. Nerve conduction velocity, also called nerve conduction study, is a test that detects damaged nerves. Nerves are stimulated by electropads attached to the skin, which measures the speed of conduction of electrical impulses through the nerves. Electromyography is a test that records electrical activity of the muscles. When an abnormal electrical current is shown, this can indicate disease, such as ALS, muscular dystrophy, inflammation of the muscles, and more. When a patient has unexplained muscle weakness, electromyography is often done. To perform an electromyography, a needle is inserted into the muscle through the skin. Electrical activity is detected by the needle and displayed in the oscilloscope. With each contraction the muscle makes, an action potential is produced. The size, the presence, and the shape of the wave, or action potential, provides information about how the muscle is responding to the nerve impulses. In a healthy muscle, there will be no action potential during rest, just with muscle contraction. And in a damaged muscle, or if the muscle has lost input from the nerves, there will be activity during rest and abnormal readings during contraction.
Okay, we're going to start with treatment now. Medication and therapy can slow the disease and reduce discomfort, but remember there is no cure. Treatments can't reverse the damage already done, but they can slow the progression of symptoms, prevent complications, and make the patient more comfortable and independent. The patient will need an integrated team of doctors trained in many areas and other healthcare professionals to provide care. This may prolong their survival and improve their quality of life. And some potential specialists to be seen may be a primary care physician, neurologist, speech therapist, palliative medicine, occupational and physical therapist, pulmonologist, and respiratory therapist. Now I'm going to talk to you guys about the medication. Medication is dependent upon the stage, and there's currently 2 medications that are approved by the FDA for the treatment of ALS. The first one is riluzole. This drug appears to slow the disease's progression in some people by reducing levels of a chemical messenger in the brain called glutamate. This level is often present in higher levels in people with ALS. The medication delays the onset of ventilator dependence or tracheostomy in some patients and may increase survival by approximately 2 to 3 months. Side effects of this medication include dizziness, GI disturbances, liver function changes, and it's available in tablet and liquid form. The second medication, called edaravone, is FDA approved recently in 2017 based on a 6-month clinical trial that showed it reduced the decline in daily functioning associated with ALS. The drug is IV, typically given 10 to 14 days in a row once a month, and side effects include bruising, gait disturbance, hives, swelling, and shortness of breath. Now note, this medication contains sodium bisulfite, which may cause a serious allergic reaction in people with sulfite sensitivity. Both drugs reduce the levels of glutamate that's often present in people with ALS. The doctor may also prescribe medications to provide relief from other symptoms such as pain relievers, muscle relaxants, and medication to help ease cramps and spasms. But remember, none of these can fix the damage already done, and they are not a cure for the disease. Now I'm going to talk to you about some of the therapy and medical procedures that are possible for a patient with ALS. Physical therapy, our textbook recommends moderate intensity endurance type exercises for the trunk and limbs to help reduce the spasticity. Now, a physical therapist can address pain, walking, mobility, bracing, and equipment needs that help the patient stay as independent as possible. The physical therapist can also help the patient adjust to a brace or a walker or wheelchair and may suggest devices such as ramps that make it easier to get around. Regular exercise has been shown to help improve the patient's sense of well-being. Appropriate stretching can help prevent pain and help muscles function at their best. Practicing low-impact exercises help maintain cardiovascular fitness, muscle strength, and range of motion for as long as possible. Now, occupational therapists can help find ways for a patient to remain independent despite hand and arm weakness. Adaptive equipment can help them perform daily activities such as dressing, grooming, eating, and etc. An occupational therapist can also help modify their home to allow accessibility and reduce the risk of injury. Occupational therapists have a good understanding of how assistive technology and computers can be used even if the patient's hands are weak. Speech therapy, because ALS affects the muscles you use to speak, communication is an issue in advanced ALS. A speech therapist can teach adaptive techniques to make the patient's speech more clearly understood. Speech therapists also can help explore the methods of communication such as an alphabet board or simple pen and paper. There's many devices such as tablet computers and that have text-to-speech applications or computer-based equipment with synthesized speech that may help the patient communicate. Our textbook specifically states that speech pathologists encourage patients to participate in what is called voice banking programs that record key words and phrases in the patient's own voice and then can be used as a tool when the patients may not be able to speak any longer. Now, there are a couple medical procedures after the progression of this disease that patients typically require. The majority of ALS patients will eventually experience difficulty breathing, and a tracheotomy may be necessary. This procedure requires surgically creating a hole in the neck that leads into the trachea, which a tube is inserted. The other possible procedure is a PEG tube placement, which is a surgical insertion of a tube through the abdomen into the stomach, used for feeding or drainage. This helps the patient with dysphagia to provide reliable access for medications and nutrition.
Risk factors for ALS patients are as follows. Hereditary. Up to 10% of people who suffer from ALS inherited the disease from either their mother or their father. Those patients who have inherited ALS disease, their children are at a 50-50 chance of also developing the same disease. Age. The typical onset of ALS is 55 to 75. Gender. The book says that men are more commonly diagnosed with this disease than women are by a ratio of 2 to 1. With the little research that I did, men are more likely to get the disease before women before the age of 60, but after the age of 70, the difference between men and women disappears. The incidence of getting ALS becomes equalized. But that was just something that I found to be interesting. It wasn't in the book. The book says that men get the ALS disease more than women do, so we're going to stick with that. Geographic and dietary. People living in certain parts of Japan, Guam, and West Guinea have an increased risk of developing ALS, which lead to diet being a contributing factor. Military. This research has been done recently, but strangely, studies seem to show or indicate that people who have served in the military may actually be at a higher risk of contracting ALS. Malabsorption and dehydration are complications seen in the late stages of ALS. The muscles we use to control our ability to chew start to deteriorate, making it difficult for these patients to eat. I'd imagine that eating would become a huge tax for these patients, making them lose appetite to eat. Also, the muscles that control a person's ability to swallow are also deteriorating. So now they have the risk of aspirating liquids or foods into the lungs. Oftentimes, this happens and the patient develops pneumonia, which is a life threatening complication for these patients. Respiratory issues. Respiratory tract infections are oftentimes the most common cause of death amongst ALS patients, the most common type of infection being pneumonia. This happens as the respiratory system loses its function. Aspiration of liquids and foods in the lungs also can cause pneumonia. As mentioned before, because of the slow deterioration of all muscles in the body, the respiratory muscles also are affected and they lose their strength, making it extremely difficult for them to breathe. Eventually, they can no longer breathe on their own, and we'll see in the hospital that these patients in the later stage of ALS are put on tracheostomies. Dementia. 30% to 50% of patients diagnosed with ALS also develop brain defects that can lead to cognitive decline, impairment, and emotional instability. Even sometimes, these patients develop dementia like diseases such as Alzheimer's. Very unfortunately for these patients, there is no cure for ALS disease, and death is inevitable. Most patients die between 2 to 5 years after being diagnosed with the disease. With this in mind, it is our responsibility to help these patients throughout this difficult time. Think back to what we learned in the grieving chapter. These patients and their families will be going through a lot, and it is our responsibility to support these patients and their families.
Encouraging exercise is important with dealing with someone with ALS because it reduces spasms that may occur. So, if the patient is able to do their own active range of motions, encourage them, or the nurse may have to do the passive range of motions. Identify and decrease the risk of injury by educating the patient of good hygiene with their hands and also devices to decrease the risk of nosocomial infections. Also, assess the patient for muscle strength and utilize the bed and chair alarms to reduce the risk of falls. Reposition the patient often to reduce the risk of injury to the skin and also administer fall risk precautions. As a nurse, we should provide support to the patient who is dealing with ALS. We should encourage them to be as independent as possible. We should listen to the patient for their needs and goals and try to apply those needs and goals to the patient. If they're unable to talk or have difficulty speaking, we should find resources to help them with the communication because that is important when with dealing with someone with a chronic disease like ALS. Also, being there for the patient is very important. Last but not least, we should be able to identify and reduce the risk of aspirations. Determining the liquid viscosity that's tolerated by the patient helps reduce aspiration because thick liquids are better than thin liquids. Sedatives impair coughing and swallowing, so minimizing them can help. Elevate patient to the highest position possible helps with improving gastric emptying. Maintaining good oral care prevent accumulation of thick secretions, educate the patient on signs and symptoms of aspiration on the lungs, and perform deep breathing and cough exercises.